Today I'm speaking with Kimberly Carson, CEO of Breast Cancer Canada. Kimberly, this is such an important topic for women. October is Breast Cancer Awareness Month. Why is this month so important?
You know, I think it's a great opportunity to remind people that breast cancer still affects 1 in 8 women in Canada, and that there's a lot of things that we can do to help make sure that we detect it early, that we treat it well. We know that the early detection makes a much better outcome for patients. So, you know, bringing that awareness, reminding people to get their mammograms, it's really important to keep that top of mind.
And you mentioned early detection, and this is something that I think a lot more women under the age of 50 need to start getting better at. What would you suggest for that younger generation in terms of regular checkups, and what message do you have for them?
So in Ontario, they've just lowered the age to the age of 40. So for screening and detection at the age of 40, so I encourage them to get out there, get those mammograms done. As of October the 8th, Ontario has changed the rules. So, and for younger women, I would also suggest that you know your own health, know your own breast health, even if you're younger than 40. You know, pay attention to any changes that you've got in your own breast health.
Kimberly, this week marks the launch of the Real Canadian Breast Cancer Alliance. Could you explain what the Real Alliance represents and how it's going to transform patient care?
You know, we're really excited about the Real Alliance. So what it is it's a group of individuals that treat breast cancer patients in different disciplines, and they've come together to look at standardizing care in Canada so that it doesn't matter where you live, you should receive the same care. So it's trying to get away from that disparity of rural and urban, and you know, equitable access to healthcare. We're really excited about them putting their names forward. They volunteered their time to make this happen, and you'll be hearing more and more about them in the coming years.
And this is something that I think could relate to our audience a lot, because a lot of our audience members, they do come from multicultural backgrounds. Maybe they don't have access to as much information in their language, or they just don't know how the Canadian system works. How are you making sure that these people are also having access to proper healthcare and information?
So one of the initiatives we launched around this time last year was a program called Progress Connect. And it is the most accurate, up-to-date information on your breast cancer journey, and it's specific to your journey. So the difference is there's over 50 different types of breast cancer. So your type of breast cancer is probably very different than anyone else's type of breast cancer, even if you know someone else who's been affected by breast cancer. So we encourage people to go on to Connect. The Real Alliance also keeps Connect up to date, so it is the latest in treatment, and it walks you through your own personal journey. At the end of filling in your information, you will have your own report, and it gives you the timelines, it gives you the different medical people that you're going to see, and it gives you the different types of treatment that they're going to suggest, so that you have a really good starting point to have conversations with your medical team.
And you mentioned Progress Connect. Can you talk to us about Progress Tracker and what that does for patients?
So Progress Tracker is another project that we launched just over a year ago. And what Progress Tracker does is it asks the patient, anyone who's lived through the experience of breast cancer, doesn't matter where they are in their journey, they can get involved, and we ask them to fill it in. A questionnaire is 4 times a year, and we're asking people to continue to do that for close to 10 years, so we can get the longitudinal data of what happens to breast cancer patients. We all know all kinds of information, but we don't have it all collected into one database. So we're asking patients to get involved no matter where they are in their journey, if they're newly diagnosed, if they're in radiation or surgery, chemotherapy, or if they've been 5 years, 10 years clear. Please still get involved, sign up to Progress Tracker, and then we have that data from the patient themselves so that we can use that to make some policy changes in the future.
And it's no secret that receiving this diagnosis is something that is very difficult on people and their families. Are there any resources for their emotional well-being or helping them kind of transition through this new chapter in their life?
Yeah, there absolutely are a number of different organizations. There's Wellsprings, there's Gilda's Club. All of them have online portals as well. So I would certainly, encourage everyone to reach out to either your own network or reach out to a support network that can help you, and ask your medical team. Your medical team will be able to as well give you suggestions on where to find that emotional support.
And with this month, I would love for you to share with our audience, how can they get involved? How can they support? What different ways, not just in October, but year-round?
Yeah, well, if you're a breast cancer patient, we suggest breastcancerprogress.ca. We always have our fundraising challenge going on at this time of year, so we have the raisemorechallenge.ca. There's all kinds of information on our website about how to donate, so there's breastcancerprogress.ca. And then, of course, we have volunteer opportunities. So with Progress Tracker, we have all kinds of volunteers across the country that help support those patients when they're entering their information, or if they don't understand how to put their information in to connect, to get their own personal report, there's volunteers that'll help with that as well. So we're always looking for volunteers that are willing, able to help other breast cancer patients, or get involved in any of our events. We have events as well, Mother's Day walks, and there's all kinds of things going on in the community across the country, so there's lots of opportunity to get involved.
And in October, are there any events in specific that you would want to share with our audience?
There's the Raise More Challenge, which is the big event that we're doing now, so certainly suggest you go to the raisemorechallenge.ca and sign up and participate in that event.
Amazing. Well, Kimberly, thank you so much for joining us.
Thank you very much for having me.